Hey everyone, I just want to start off by saying I miss you guys so much and I hate we're having to go through this, but hope everybody's doing well and I hope you don't mind listening to me talk a little bit about my patients. I also have some notes in my lap, so if you see me looking down, that's what I'm looking at. I made these little cue cards to help me go along with what I'm going to talk about, so it may be a little more interesting than just having to sit there and listen to me. So first off, I want to talk about how the ED, I was in the ED for my preceptorship, and how it's a little different when you get report versus when you're on the floor, like for adult health. A lot of times I work day shift, and there'd be some times that we would get on the floor and there'd be absolutely no one in our assignment, and then within 30 minutes our 4 rooms are filled. And we probably see up to 20 to 25 patients every day, so it's a lot of in and out. So it's not like you go get report from another nurse. Now there was sometimes that there would be patients on the floor that we would get report about, but it was very brief because a lot of times it's like your average nausea, vomiting, give them Zofran, send them on their way, they're good, that type of deal. But this patient I'm going to talk about today, I'm going to start out with my situation. I don't exactly remember her age, but she was about 65 years old. She was a female. She had fallen and broken her arm about 2 weeks ago, and she was going to an orthopedic appointment, and this patient, hasn't had difficulty breathing before. She doesn't have to use a walker or anything like that, and she was with her daughter and her husband, and they were walking into her appointment, and she took maybe 30 steps, they said, and she was like, could not breathe, like was having to sit down, like it was out of her norm. So her ortho doctor wanted to recommend her to come to the ED to get that checked out, just because it was out of her norm. Difficulty breathing can be a scary thing. And so background on this patient here, I said before, she never has had difficulty breathing before. Her daughter said she was on Lasix, but had never been diagnosed with congestive heart failure, but she was on Lasix for fluid retention, and she had recently stopped taking that because the patient was complaining how she was having to get up in the middle of the night and you go to the bathroom, which is common with Lasix. We know it's a diuretic. So she stopped taking it, which is kind of a red flag to us, like, hey, there's probably some fluid retention. Other than that, her vital signs were stable, except for her oxygen sat was less than 94%. So we knew that was something with gas exchange not correct or not right. Also, another diagnosis this patient has is she had restless leg syndrome, which I had heard of before but never seen actually in a patient, which was really interesting, which I saw it. I was hooking her up to an EKG, and one of the other nurses, he was giving her an IV, and like the whole time her port beat were like, it was like she was trying to push the gas pedal the whole time, just kept going back and forth, back and forth. So initially our assessment for the report was we just focused on that shortness of breath, because in the ED it's quick. We don't really do your head to toe assessment. It's very focused. We saw shortness of breath. We knew we needed to act on that. We knew we needed to get oxygen in this lady. She was in no pain, but it was obvious that she was very labored breathing too, trying to get it in. So we were trying to keep her very calm. So as I said before, our recommendation for the SPAR report was to stabilize the O2 stat. Like again, I said, do the relaxed breathing, try to calm her down, and we knew we probably needed to restart that Lasix. So my ADPI assessment, we listened to her lungs. There was lots of crackles. We assessed her legs for swelling. That was pitting edema. We'd push on it where we pushed into the leg, it stayed. Also, her daughter brought it to our attention that since she had stopped the Lasix, her mom has been having really trouble going to the bathroom, like was having to push out her urine. And we did get a urine sample from her, and it was very dark, had a very strong odor. So again, that was another red flag that this lady's probably retaining fluid. She also had an ABG done, and the oxygen level was very low on that. So my nursing diagnosis for this lady is impaired gas exchange related to fluid retention in lungs, as evidenced by crackles and a low O2 sat, as well as a low oxygen reading on the ABG. So my planned outcomes for this patient I want this patient to have an O2 stat greater than 94% within 30 minutes of putting her on 2 liters of oxygen. I also want this patient to urinate at least 30 milliliters every hour after the administration of Lasix. So my interventions for this patient. Although medication administration really isn't a nursing intervention, I knew it was important that the doctor had ordered it, that we needed to get in this patient as soon as possible. One thing that we did do for this patient, because she had the restless leg syndrome, she had difficulty walking, and we knew that she was going to be going to the bathroom more often, and we didn't want her to walk. We didn't want to increase her risk of falls or anything like that. So we did get her a bedside commode to help with that, and thankfully her daughter was in the room, and this lady was peeing like every 5 minutes after the Lasix, and her daughter was able to help her to the bedside commode, which made it much easier for us because we had 3 other patients as well at this moment. I wanted to make sure the patient stayed in high Fowlers to help with that breathing. You know, we don't want her laying down if she's not able to breathe. And like I said before, we wanted to practice that relaxed and slow breathing to get that oxygen really in instead of like she was doing. And so my evaluation for this patient, on 2 liters of oxygen within like 10 minutes of the Lasix administration, her oxygen was stable. It's above 94%. Now we didn't take her off the oxygen because it was stable. We wanted her to keep her that way. We did also educate her on the possibility of having to have oxygen at home if this was starting to become an issue. Like I said before, this lady was peeing like every 10 minutes. So within an hour that we gave her the Lasix, she had peed almost 400 milliliters, which was evident that she was holding a lot of fluid in her body. And there's nothing really new I would recommend to this patient. I don't think that she would need to go to the floor for anything, because if she's able to get that Lasix on a good routine and taking it every day, I think her condition will be much better. I think there's a lot of education that needs to be had for this patient. Like I said, with the oxygen, the medication, because she was given the medication before and decided to stop taking it. So we need to reiterate why it is important that she does take it. So overall, I was very happy with the outcome of this patient, and hope you guys enjoyed my video.